In my conversations with hormone providers, one theme that comes up again and again is the idea that patient education is one of the most fulfilling, but at the same time most frustrating parts of their practices. Providers have told me about 5 specific pain points that make hormone consultation a little bit harder than it needs to be. In this video, I'm going to walk you through all 5 of those pain points, the exact frustrations that you've maybe felt yourself, and then I'm also going to show you a simple solution that can help you overcome those frustrations. The goal is to free you up from repeating yourself, from fighting that misinformation and wasting time so that you can get back to what you're truly passionate about, transforming patients' lives through hormone optimization. Leave a comment below. I'd love to hear from you. If you could wave a magic wand and change patient education in your practice, what would that look like? What would help you the most in teaching your patients? Let's start with the first frustration that providers have talked to me about: patients who are hesitant, fearful, or even terrified of hormones. We've probably seen this in your own practice. A patient walks in already scared, worried that hormones are going to give her breast cancer. Well, I've personally gotten hundreds of emails and YouTube comments from women who said they were basically terrified about hormones increasing their risk for breast cancer, primarily. Yet at the same time, they've also been devastated by life-changing symptoms: hot flashes, night sweats, vaginal dryness, and they feel completely stuck between those extremes. It's not just women either. A good friend of mine in his 70s is a candidate for testosterone optimization, but since his brother died of prostate cancer, he won't even consider it. Even though the research strongly supports testosterone's safety, even for the prostate, my friend's fear overrides the evidence. Well, that fear slows down decision-making, sometimes keeps patients suffering unnecessarily. It puts providers in the position of having to unteach decades of misinformation. The good news is this: when patients have clear, evidence-based education before they ever sit in your office, they can come in calmer, maybe more open, more ready to listen to what you have to say. But fear isn't the only problem. Even when patients finally decide, okay, I'm going to start hormones, many of those patients still don't really understand what hormone optimization is all about. They see hormones as nothing more than symptom relief. Too many patients think hormones are just for hot flashes or night sweats, or for men, erectile dysfunction and sex drive. Once those symptoms back off, patients figure they don't need hormones anymore. Well, I've seen firsthand how dangerous that kind of thinking can be. My mom and my mother-in-law both sailed through menopause without any major symptoms. But because they didn't feel bad, they didn't do anything about the silent risks of hormone deficiencies. For my mom, that meant severe cognitive decline and osteoporosis, a broken hip. For my mother-in-law, her osteoporosis was so severe she spent her last decade in a wheelchair. She lived in chronic pain from crumbling vertebrae and multiple hip fractures. I was at a medical conference a few years ago and talking with a group of hormone practitioners. They were sort of joking that women with the worst symptoms are actually the lucky ones, because at least those hot flashes force those women to take action. You can sit across from patients and explain the data on heart disease, osteoporosis, cognitive decline, sarcopenia. But as long as they're not miserable with those symptoms, they just don't feel the urgency to act on hormone deficiency. Clear education reframes hormones as more than just symptom relief. It helps patients see hormone optimization as an investment in their long-term health. And that misunderstanding creates another challenge, because when patients think hormones are just about hot flashes or night sweats or erections, they tend to ask the same surface-level questions over and over. Don't hormones cause breast cancer? What about heart disease? Does testosterone increase my risk for prostate problems? What about stroke? Providers get worn down answering those same questions over and over and over again with each new patient. That endless repetition eats up time in the office visit, as well as your energy. It leaves less space for what providers actually enjoy, which is digging into the unique, patient-specific issues that go beyond Hormones 101. And that's where Simple Hormones comes in. My patient education resources don't replace what you teach in the office, but they do take the time pressure off. Think of them as homework for your patients. Patients can learn the basics on their time, not yours. So your office visits are focused on what matters most. So how do you solve that repetition problem? One option is to create your own videos or handouts to get those basics out of the way. But for most providers, that turns into its own set of frustrations. Many providers tell me, well, I'd love to create my own videos or handouts, but who has the time for all that? One doctor I talked with on a Zoom call swung her camera around to show me her full video studio setup. She had every intention of making her own patient education content. But the reality sort of hit her hard that coming up with topics, writing scripts, filming, editing, posting, promoting all that video, it sort of felt a little overwhelming to her. Her lights and her tripod just sat there gathering dust because she just didn't have the time to do it. Without consistent high-quality content, patients end up back on Google asking questions of YouTube, confused, misinformed. That's why having done for you professional resources can save hours of work while still giving your patients accurate, aligned education. There's another bigger challenge. It's not just patients who might push back. Sometimes it's your colleagues or even state boards of medicine. That can feel like the most difficult battle of all. This is one aspect of patient education I hear about all the time. A patient's other doctor says, hormones are dangerous. You need to get off those immediately. They're going to kill you. Well, sometimes it's more direct. A phone call, a text message, or an email from a colleague questioning, why did you ever prescribe hormones for our mutual patient? Almost always, these are rooted in long-held dogmas and maybe misinterpretations of the research. Women's Health Initiative, anybody? In some cases, it's downright frightening. When a state medical board or nursing board gets a complaint sparked by some sort of misinformation, claiming that you've stepped outside the bounds of standard practice, well, that kind of pushback can undermine your credibility and leave your patients confused about who to trust. Providers tell me that an educated patient who truly understands and embraces hormone optimization is less likely to abandon hormone treatment when they hear those scary comments from their other doctor. They're more likely to trust you as their hormone optimization specialist. If any of these frustrations sound familiar, you're not alone. The good news is that you don't have to keep fighting these battles on your own. Patient education doesn't have to be confusing or overwhelming or time-consuming or repetitive. I've created some resources that are designed to move your patients from confusion to clarity, to help them trust you more deeply, and to give you back the time and energy to focus on what you love most, transforming patients' lives. If you'd like to learn more, check out my resources at simplehormones.com/subscription. Thanks so much for watching, and I'll be seeing you in the next video.